And my topic is prevalence of undiagnosed high blood pressure and coexisting risk factors among selected population in Georgia. That was conducted in 2015. At the United Nations Sustainable Development Summit on September 2015 was adopted Sustainable Development Goals. And one of them, the goal 3, is dedicated to non-communicable diseases, and sub-goal 3.5 is aims to reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment. Global Action Plan for Prevention and Control of Non-Communicable Diseases that was offered by World Health Organizations. Organizations have 9 main targets, and one of them is dedicated to prevalence, especially, and it aims to reduce prevalence of hypertension globally by 25% by 2025. 2 other targets that are circled in the slide also dedicated to non-communicable diseases and aims to high coverage by treatment and prevention of non-communicable diseases, including hypertension. Burden of hypertension is very high, and this is a significant public health problem worldwide as well as in Georgia. And raised blood pressure is one of the leading risk factors for global mortality, and it accounts about 9.4 million deaths and 7% of disease burden worldwide. And the global prevalence of raised blood pressure is about 22%, and control of hypertension through controlling of cardiovascular diseases risk factor is a very good way to prevent and avoid high mortality. And early detection of hypertension and risk factor management is a good way to prevent early mortality from myocardial infarction and stroke that are main leading causes of death from cardiovascular diseases. This slide shows age-standardized prevalence of raised blood pressure worldwide, globally over 18 years of age, and you can see that prevalence of high blood pressure in many regions of the worldwide that are marked in red is very high, and it is more than 30% of population. This is, Georgia is a small country, and it gives some demographic and socioeconomic situation about, this slide gives information about Georgia and its socioeconomic demographic situation. Georgia is a small country with population of 3,700,000, and it is located in Caucasus region bordering Russia, Turkey, and other Caucasus countries. And premature and expected life from at the birth is about 72.9, and government expenditure for health is not too high. This slide shows leading causes of death or ages in Georgia, and you can see that about 94% are caused by non-communicable diseases, that especially from cardiovascular diseases, and it accounts about 69% of all deaths. I'm giving here routine results of routine statistics and distribution of cardiovascular diseases and hypertension during the time period from 2004 to 2018. And after 2012, you can see small increase of incidence rate of cardiovascular diseases, including hypertension, and it is caused by implementation of universal healthcare coverage that was implemented in 2013. Our study objectives that I noted that it was dedicated to World Hypertension Day in this year, 2015, main goal was objectives was assess the prevalence of undiagnosed high blood pressure and coexisting risk factors and raise awareness regarding prevention activities of population and primary healthcare practitioners. Study was conducted descriptive study. It was conducted in selected schools in Tbilisi, capital city of Georgia, 3 schools in Nadzaladevi region. This is one district of Tbilisi, capital city. 3 schools were selected randomly, and among these 3 schools, all teachers were screened for high blood pressure and were interviewed by using standard questionnaire that was suggested by World Hypertension League. And definition that we used in our study, it was blood pressure higher than 139 to 89 was assumed as high blood pressure. Body mass index between 25 and 29.9 was assumed as overweight, and obesity was if body mass index was over 30. Main study results. You can see here, totally 156 teachers were participated in this study, all females, and age range was 28 to 69, and overall proportion of high blood pressure was about 34%, but over 40 years of age, proportion of high blood pressure was about 49%. And main result, what we get from our investigation was that among persons with high blood pressure, about more than 36%, they are not aware that actually had high blood pressure and they, did not receive any medicines. And among those, 14% received medicines without recommendations of public health practitioners, of physicians. And also one more important information result about risk factors, that all patients with high blood pressure were overweight or obese. This slide gives information about prevalence of risk factors, and you can see that all study population were divided into two groups. One of them, all population, and another, this red bars gives information about prevalence of different risk factors among all study participants, and blue one gives information about among those who had high blood pressure. And you can see that overweight and genetic factors were much higher among study participants with high blood pressure versus to others. We don't study many risk factors, because questionnaire that was used during investigation, this is questionnaire suggested by World Hypertension League, included only few number of questions regarding risk factors. It was overweight, obesity, genetic factors, and also awareness about cardiovascular diseases and diabetes. And next table on this slide shows that overweight was increasing with age among study participants. This is information about study participants who are being advised for healthy behaviors by health workers. This is, the problem is that public health practitioners and primary healthcare practitioners and family doctors have very close contact with population, with patients, and they should give some information and raise awareness about risk factors, healthy behaviors of population and patients, but it does not happen. It did not happen, and it is a big problem among our population. Healthy behaviors that we included in our questionnaire, it was to reduce soft intake, to start or do more exercise, to consume healthy food, and to lose weight. And you can see that you have also, I divided study participants into two groups here. One of them, the first slide on the bottom shows being advised all study participants by healthy workers, and another one gives information about if study participants who had high blood pressure were being advised about healthy behaviors. And you can see that both of them don't have enough information about healthy behaviors from health workers. Study limitations. I mentioned many times that study participants were selected in Tbilisi region only, and we included only school teachers, and only females were study participants. Now, conclusions and recommendations. Main conclusion is that prevalence of undiagnosed high blood pressure and coexisting risk factors is high, even among educated people in Tbilisi, in capital city of Georgia. And we have two recommendations. The first one is to conduct further studies among other groups of population, because we could not generalize this data, because this investigation was survey was conducted among selected population, and a small number were included included small number of participants, and because of this, to generalize this data, we want to further this investigation and then to give to the government results to implement some screening activities against hypertension and awareness increase activities. Because state screening program we have against cancer, and it was implemented in 2011, and we are working enough well, but we don't have the same programs regarding hypertension, and because of this we want to give results, we want to have results to implement such project in our country. And another recommendation is most important to increase awareness regarding hypertension and other cardiovascular diseases among population and even physicians and family doctors. Thank you.
Thank you very much for your presentation. Questions? There.
Thank you for your presentation. Can you just elaborate the argumentation behind choosing teachers? Why did you choose teachers from the very beginning?
Okay, thank you very much for this question. Yes, I noted that we started to conduct this study among educated population because teachers, they are educated, they have job, they have insurance, and because of this, they should know levels of their hypertension, and they should attend to, they have possibilities to attend to physicians and get treatment. And we know that the other part of population, we have the situation is the worst, but we started from this population to see what is happening here, and then we are going to further this investigation. Thank you.
More questions?
Can you say why you level of blood pressure you in case definition? Can you please show me? 139. I think it's no correct.
Too high?
Because you have to take 125. I think so. It's no high level. Two case definition, I think.
Okay. Thank you very much for your question. I believe that this topic will be subject of discussion here at this conference. You know that before conducting the investigation, and in this investigation we have participated cardiologists, not me, only epidemiologists. And before giving this definition, we had discussion, and I showed this level what we have in our country. According to our definition, I know this, it is too high, but it is the definition what is used in my country, and I had discussion about this with other. I invited all persons, participants, all cardiologists, hypercardiologists who are in my country, and this is the level what they advise, what they are using it, because I could not change this right now, and well, I know this is
thank
too.
You. I understand
yes.
you, but we know it's high level. Well, thank you.
Thank you.
Okay, maybe not high level, but it's the borderline between 120 and 139, so you're right. Yes, Mike?
Thank you for a nice presentation, and it's interesting to hear a non-communicable disease topic, but obviously a really important public health issue. Did you also ask about smoking in your study, both as a potential risk factor for hypertension, but also as a multiplying factor in terms of the long-term risks of cardiovascular disease?
In this, as Thank you very much. It's very important question, and smoking is very problematic in my country. Know that in population, 30% of all population are smokers, and among men, this is all population. Among men, about from 40 to 50% are smokers. It's according to different age groups, very high smoking habits. But you know, I mentioned many times we use standard questionnaire. That was offered by World Hypertension League, and this questionnaire and all this survey was dedicated to World Hypertension Day. And because of this, we used only this questionnaire and did not collect information about smoking in this way. But we have a step, we conduct, in my country, there is ongoing many surveys, studies that are collecting information about habits, smoking, and many activities against smoking. It is really problematic for us, public health issue, smoking.
Any other questions? Okay.
Okay, thank you
Thank
very
you.
much.